Okay, good morning, guys. Happy Independence Day. Today is part 5 of the Outpatient Care series, and what we're going to talk about today is when healing stops feeling human. Over the last 4 videos, we've talked about medication refills, how decisions are made when patients call needing to be seen, and how documentation helps tell a patient's story. But I don't think this series has really been about any of those things. I think it's been about something deeper. When I became a nurse, I quickly learned that healing isn't only found in medications, procedures, or test results. Those things are incredibly important, but healing is also found in the way people are cared for. One of my favorite parts of nursing was patient education. And not because I enjoyed talking, but because I loved seeing the fear a patient had begin to disappear when they finally understood what was happening or about to happen. Sometimes I would explain why a medication needed to be taken on time. Sometimes I would explain what pain to expect after surgery and why walking after is so important, even when it's painful and difficult. Sometimes I simply explained what I was about to do before I did it, because understanding changes how people experience illness. There's a patient that stayed with me through the years. I have quite a few of those. But this one needed an unexpected abdominal hysterectomy, and she was terrified. I had been through one myself, so as I got her ready, I told her what to expect, and I sat with her after, and we talked about other things. We talked about pain, about getting up to walk after surgery, even if it's really painful the first time, especially. I talked about the gas pain that often surprises people after surgery, but we also talked about how each day would get a little bit better. We even discussed some hormone replacement options for after as well. I shared with her the options that I had tried in the past, and then the option that worked best for me and why. A few days later, when I was coming into work, I saw her walking laps in the hallway of that inpatient unit. And she called my name because I didn't see her at first, and she came up to me and gave me the biggest hug. She told me she wasn't nearly as afraid after because she knew what to expect. And she was doing so well that she went home earlier than expected. She told me she was getting discharged that day. She told me that I made her feel human. I don't tell that story because I think I did something extraordinary. I tell it because it reminded me that education isn't just information. It's reassurance. It's helping someone feel less alone. As both a nurse and now a patient, I've also learned something else. Patients may not remember every medication they've received. They may not remember every lab that was drawn. They may not remember every number in their chart. But they'll remember often how they were made to feel. Whether someone listened, whether someone explained, whether someone took one more minute just to answer a question, whether someone helped them feel like a person instead of a problem. Healthcare has changed in so many ways. Technology has advanced, documentation has become more complex, workflows have become faster. The demands on healthcare professionals have grown tremendously. And I know that the people working within those systems are carrying enormous responsibilities during the day. And this series has never been about blaming them. It's been about remembering what patients need us to never lose. Over the last 5 videos, we've talked about, again, med refills, triage, documentation, and now patient education, and the changing experience of outpatient care. But I don't think this series has really been about any one of those things. I think it's been about something deeper. It's about the value of clinical judgment and what happens when patients no longer see that at work. Clinical judgment isn't just a skill. It's listening beyond the obvious. It's asking one more question. It's recognizing when something doesn't quite fit. It's connecting details that on their own may not seem important, but together they tell the story of a patient. And I believe that's something worth protecting, not because of nostalgia, but because every patient deserves to be cared for as a person, not just as the next task in the workflow. Never lose sight of the person behind the symptoms. Remember the human in healthcare, guys. This is just a nurse writing from a patient's chair. Thank you for listening, and we'll see you again tomorrow.